Welcome to Season 5 of AIHA's podcast series, The Healthier Workplaces Show, where we explore timely and informative topics about occupational and environmental health and safety. I'm your host, Alejandro Castillo. Today, I have the pleasure of speaking with industrial hygienist and fellow of AIHA, Dr. David Krause. Dr. Krause completed a Master of Science in Public Health and doctorate at the University of South Florida, where he researched the toxic impacts of indoor candle combustion and mold growth on building materials. Dr. Krause has over 30 years of experience in public health, occupational hazard assessments, and indoor air quality. As a former member of the ACGIH Bioaerosols Committee and past chair of the AIHA Indoor Environmental Quality Committee, Dr. Krause is a nationally recognized expert in assessing the risk of exposure to pathogens and hazardous chemicals. In 2021, Dr. Krause was awarded a patent for the system to control Legionella and other waterborne pathogens by reducing dissolved oxygen levels. Today, we're here to learn more about Legionella and other waterborne pathogens in building water systems, fundamentals for technicians, the first level of the Legionella and other waterborne pathogen certificate program. This technician level course is the first of 3 required learning components in the full certificate program. Successfully completing this 23-hour online course prepares participants to collect water samples for pathogen analysis, take water parameter measurements, and accurately document findings and observations. Earning the technician level certificate demonstrates your mastery of essential knowledge and skills to reduce risk in building water systems, and serves as the foundation for advanced levels in the program. David, thank you for joining us today.
Thanks for having me. I'm looking forward to the conversation.
Let's get started. For listeners new to this topic, what exactly is a waterborne pathogen, and what can you tell us about Legionella?
Well, strictly speaking, waterborne pathogens are typically bacteria, mycobacteria, sometimes even viruses and fungi that travel in the water system, and people are exposed from the bacteria that are present in the water. Sometimes they're considered something that you would drink. Sometimes it's something that gets on your skin. But predominantly, we're finding that most waterborne pathogens that really cause severe disease and even fatalities are those that you breathe in the small droplets of water called aerosols.
In 2018, the CDC reported the highest number of reported Legionella cases in the US at just under 10,000. The NASAM report released in 2019 estimated the actual annual number of cases is somewhere between 52 to 70,000 cases. Why is there such a discrepancy, and is this a concern?
Absolutely a concern. So Legionella is kind of an accident of legislation. It became a nationally notifiable disease soon after the first outbreak that it was recognized in 1976. So state and federal and even local county health departments by law throughout the United States have to report all diagnosed cases of Legionnaire's disease, or what they also call legionellosis. So we've got pretty good records for many decades on the number of cases, but we also recognize that most cases are underreported. So we don't physicians don't capture most of the cases, and even when they are diagnosed, they aren't always reported up to the federal reporting system. The National Academies of Science, Engineering, and Medicine, NASAM, they did a great report looking at other studies to look at how underdiagnosed Legionnaire's disease is, and that's how they realized that we're probably only capturing between 10 to 15% of cases every year in that national notification system that the CDC numbers are coming from.
Wow. Now, why is the current Legionella training described as minimal in this industry?
It's often been limited to public health agencies providing a snippet here or a pamphlet or a 2-page training information docket, or maybe a 15-minute training module on YouTube of how to collect a water sample. The bigger picture of how do you ensure that measurements and water parameters and samples and laboratory analysis results are interpreted, that's a lot more information than we typically get. We often have to learn that by trial and error, a lot of error, unfortunately. So the training is not prescribed, it's not necessary, and for someone to declare themselves currently to be a Legionnaire's disease expert requires absolutely no training, certification, or credentials. So
Wow.
It is truly buyer beware.
That to me is almost crazy to hear.
Yes, Yes, it's not just crazy, but we have licensure for mold assessments in this country, and it's a
Yes.
rare instance for people to contract infectious diseases from molds and to die from them. Whereas Legionnaire's disease, we recognize that the number of cases certainly are exceeding, 50,000 every year, and approximately 10% of the people who are diagnosed with Legionnaire's disease from what we call community acquired sources, not healthcare, approximately 10% of those people die. And then if you happen to contract Legionnaire's disease in a healthcare setting, such as a hospital or a nursing home, a long-term care facility, the probability that those people will pass from that exposure is 1 in 4. And that's an extraordinarily high mortality rate.
Let's talk about your newly released certificate program, Legionella and the other waterborne pathogens in building water systems, fundamentals for technicians. What inspired you to create this technician-focused course on Legionella and the other waterborne pathogens?
Well, the inspiration really came from the lack of it, the lack of training, the lack of competent measurements and assessments that I frequently see. So I've been practicing industrial hygiene for over 30 years now, and both in the public health sector and as a private consultant, working in variety of facilities and everything from prisons to courthouses to hotels. And what I've seen is a increase in the number of cases, an increase in the number of outbreaks, but without really having competent people who are reading from the same sheet of music. So we often will see a great disparity in the level of training and knowledge and reliability of their measurements from someone who is, a pool technician or a certified pool operator versus, an HVAC person or someone who's cleaning a cooling tower versus an industrial hygienist versus a registered sanitarian or environmental health professional. And right now, there's really nothing out there to kind of give a baseline of core competencies and where you should really be at in your ability to select the right equipment, select the right sampling methodology, determine the appropriate methodology to analyze the samples, to interpret those values, the documentation and record keeping necessary. And at this point in my career, I sit as a expert witness in a lot of cases because I get to see these Legionnaire's disease cases and all the evidence and information and documentation laid bare before the courts. And the disparity and sometimes the lack of any documentation, improperly used methodologies, ineffective equipment, uncalibrated equipment used to take measurements is pretty obvious. So I've worked with my colleagues in the Indoor Environmental Quality Committee, and we have developed a number of publications and guidelines. One of them is the core competencies that you need in order to be really practicing in this area. Not necessarily trying to prescribe how people practice, but advising them that if you're going to do this work, you really need to understand some of these basic components, knowledge, skills, and abilities so that your measurements are reliable and can withstand scrutiny.
Now, of course, effective training needs a solid foundation. Could you walk us through what this course covers by breaking down the modules?
Oh gosh, that's a lot. So the technical framework for Legionella was developed back in 2021 by a fairly large committee of volunteers under the IEQ committee. And it was intended to describe the expertise or levels of experience and knowledge for competent technicians and competent professionals. And I'll kind of describe the difference between those a little bit later. But we want to make sure everyone has at least a fundamental understanding of the parameters that they're measuring, how they're measuring them, how they can cause differences in those measurements by their own actions or choosing inappropriate methods. And as part of that, we laid out actually 3 different groups. One being the technicians, which will be the vast majority of people actually carrying out testing, sample collection and measurements, water management plan implementations. And then two different categories of professionals are really what we're looking at. One being what we call a responder professional. And a responder professional is maybe an environmental health professional from a county health department or a state health office. It may be an industrial hygienist. It may be a water technician, but someone who responds to allegations or cluster investigations. We think that there's disease associated with a certain facility or its water sources. So doing an investigation for sources of disease or an outbreak. The second professional would be ostensibly someone who's we call a program professional. So someone who would be carrying out a routine management program, ostensibly ASHRAE 188, say at a healthcare facility or a hotel or a long-term care or assisted living facility, where they are taking proactive measures to find, to carry out risk assessments, find possible sources, and to lower the average risk of Legionnaire's disease in these facilities. And you can do both, but practically speaking, most people who are running programs are not responding to outbreaks. And most people who are responding to outbreaks, hopefully, are not running programs. So they do tend to bifurcate in the populations that are served. So we split apart those two levels of professionals. But what was really critical and important here is that we actually laid out the requirement that to become a professional, you must first complete the training and requirements to become a technician. We really feel it's important that an individual who is interpreting values, interpreting sample results, setting up a sampling plan, has practical real-world experience in doing that work, understanding where errors can come into place, understanding what kind of time and effort, safety precautions, and limitations can influence carrying out these tests. So the progression is everybody needs to become a technician, and then those who wish to go further and develop a professional certification or certificate would be take those additional courses and exams.
How exciting.
Absolutely. One more test.
Recognition, Evaluation, and Control of Legionella in Building Water Systems, 2nd edition is now available. This handy guide will help you design a robust assessment capable of detecting Legionella amplification sites that pose a hazard to workers and the general public. Scan the QR code to learn more.
What kinds of real-world scenarios or case studies are included in this program?
Well, one of the things that we highlight here, especially for industrial hygiene, is the aspect of health and safety that is all but ignored. Certainly dealt with in a very superficial layer level in all of the other small, short, brief training from public health that has been put out. When we're investigating or going in places where Legionnaire's disease or Legionella could be amplifying and growing, we are inherently entering dangerous places. So mechanical rooms where plumbing systems or water heaters may be, they're often co-located with electrical systems, mechanical pumps. We're on rooftops, on cooling towers. We're sometimes having to go into vaults or tunnels where the plumbing is entering the building. We're having to deal with highly corrosive and acidic hazardous gases such as chlorine or ammonia that may be added to a building's water system. Something as simple as anticipating and looking out for slips and falls and ladder safety. All of those things have not been even scratched in the existing training that's out there. And we've made sure that in the industrial hygiene effort, we have brought those to the forefront and are teaching people these are the hazards you need to look for when you're doing this type of testing, or these inspections to make sure you come home safe with all your fingers and toes and you don't harm yourself or others. We do talk about respiratory protection when it's appropriate, when it may not be needed, and the precautions that you need to take as far as being properly fitted and enrolled in a respiratory protection program. So we've taken that to heart from our own experiences in our own industry to make sure that people are not stumbling into confined spaces, finding themselves in unsafe situations, and hopefully we'll prevent some injuries and fatalities in the future.
Absolutely. How often do outbreaks of waterborne pathogens occur, and how can it be attributed to preventable issues?
Well, first let's talk about what's an outbreak. The definition of an outbreak for Legionnaire's disease is a bit different from just about everything else. The Council for State and Territorial Epidemiologists, as well as the Centers for Disease Control and Prevention and state health offices, have generally adopted a definition of an outbreak consists of 2 or more cases of disease that have a common source of exposure that have occurred within the space of a calendar year. That's a pretty broad definition. But even with that much of a broad definition, we only see that about 5 to 6% of the cases every year are deemed to be part of an outbreak. So of that 10,000 cases in 2018, the vast majority, 95+%, were not part of an outbreak. They weren't tied together with epidemiological association. They were deemed to be single sporadic cases that were either community acquired, healthcare acquired, travel acquired, and were not tied together. So outbreaks are unusual still, but they're increasing in numbers. And they're increasing in the number of people who get ill and people who are dying from this disease. So when we look back at cases, we still the reports typically are coming from the CDC or state health offices, and they will go back and look at past outbreaks and cases. So the information I'm going to convey here are say somewhat dated, because we don't even get final numbers for 2024 until probably later this year on the number of national cases. And so we're often dealing with information that is aggregated 2 to 3 years after the fact.
Wow.
So the most recent reports that I've seen suggest that at least 35% of outbreaks are attributable to outside conditions and situations, environmental factors such as construction, water main breaks, lack of water treatment in about 35% of the outbreaks. As far as what they deem to be avoidable situations, it's nearly 85% of the cases. So we really have to look at this as a preventable disease that is, difficult to see coming. You usually only see it in retrospect. And so, under ASHRAE 188, there's been a big push to take proactive or preventive measures to control the pathogen in the water to keep it from growing to begin with, rather than reacting to it, because once the horse is out of the barn, it's gone.
Now, going back to the course, how does this course prepare someone not just for today's challenges, but for what future problems may arise?
So while Legionella is certainly the exemplar, is the one in which we have so much information on, we also recognize that other waterborne pathogens actually cause more disease, cost more in healthcare dollars, affect more people. But Legionella, we have data on. And when we start looking at conditions where Legionella proliferates and thrives and causes disease, we also find these other pathogens. So we see a common environment. They're all bugs that tend to grow in these conditions, that grow in the biofilm and the scale. They grow when the disinfectant is not consistent and high enough. They cause respiratory disease. So by inhaling them, we actually can develop disease, pneumonias that can be really debilitating and can take years off of people's lives and make them more susceptible to other diseases and just and in many instances cause death. So we're really pushing for a more holistic approach of dealing with not just Legionella, but all other waterborne pathogens, and identifying the appropriate ways to find them, prevent them from growing, and ensuring that the control measures remain effective.
Join the PPE Risk Assessments, Practical Considerations for Industrial Hygiene Exposures webinar on May 13th and earn 1 contact hour. Discover primary routes of exposure, methods for characterizing exposures, and the decision-making steps involved in selecting measures to protect the workforce. Don't miss out. Register now.
So how will this training prepare technicians to understand and apply new WP standards and state regulations?
The regulations that are coming about and the waterborne pathogen and water management plan requirements that are, developed in within an organization, they typically prescribe control points, measurements of temperature, measurements of disinfectant, measurements of scale, or hardness and calcium and pH. Well, all of these are useless if they're not taken correctly or are taken with uncalibrated equipment that provides unreliable results. So that's a big factor that we have here for the technicians is how do you make sure that you have the right equipment, measuring the right parameters, and you have confidence in the results. So that's one aspect. The other part is in collecting samples. How do you collect a sample without causing bias or undue error? How do you package that, ship it, get it to the laboratory, have the proper analysis performed, make sure you have the right preservative, make sure you're shipping it in the right time frame. These are really the fundamental building blocks of any waterborne pathogen management program, is to make sure that the people who are collecting the samples are doing it safely. They're doing it in a consistent, reliable, defensible manner. They're taking the necessary notes, keeping the necessary documentation so that you have confidence in those results. So that's the biggest aspects that we're doing here for the technicians. The other aspect that we're doing and really trying to push on is the fundamental understanding of waterborne pathogens, and so that they can be more predictive and more relevant in their observations. It's not just what measurement did you take? Are you seeing corrosion where it shouldn't be happening? Are you seeing sediment that really shouldn't be there? That may not be picked up by the sample you're measuring, you're collecting, but actually training people to be cognizant and aware and realize, hey, that's an important thing I'm seeing there, rather than just blindly going out, getting a bottle of water and shipping it off.
Of course. Now, this technician course lays the foundation for the AIHA Waterborne Pathogen Certificate Program. Can you share a high-level look at the next 2 levels, one focused on program professionals and the other on responder professionals, and how each is designed to support different roles in managing waterborne pathogen risks?
So we started off with, frankly, seems to be a big ask is developing a broad-ranging course that lays out the fundamentals, the core competencies. How to, if you're playing baseball, it's how do you hit the ball, how do you run the bases, how do you catch the ball. I mean, the simple things that we always hope are done well. We also want to train people in the technician course on how to read building plans, how to find those dead legs and sources that may not be on the building plans. But we also recognize that not everybody is going to have the experience and education or the desire to go on and take on those additional trainings and education. So with the responder professional, and again, this would be people who have completed the technician training. There's quite a bit more additional reading on the health risks associated with Legionella. How do you work with public health officials to investigate an outbreak? How do you spot or find sources of amplification? The responder professional, we also have included in that group those people who would be developing sampling plans and strategies. So, there's only so many resources, only so many samples, only so much money and time that can be devoted to this. How do you use it wisely? How do you create a sampling plan, a sampling strategy that achieves the goals of the assessment? Those people would also be responsible for coordinating the teams, because if you're doing a 700 or 2,000 room hotel, a single person is not going to be doing that work alone. So they have to be able to work with people who have hopefully technician training, or at least some level of training, and can be there to help with the massive effort that's needed when these happen. Then they would also need to be in charge of selecting the appropriate sampling methodologies and analysis, and then receiving those results from the laboratory. So getting those results, compiling them, and making sense of them, interpreting whether or not they are meaningful, whether they are reliable, and use that data and information along with the measurements of oxidant and temperature and water parameters to diagnose the building and any sources that are there. Beyond that, the responder professional would also help develop any remediation plans. So if a cooling tower or water system needed to be treated, cleaned, disinfected in order to make it no longer a health risk, they would develop those remediation plans and the post-remediation testing and validation testing to make sure it was effectively done. So that's really the big aspect of a responder professional. A program professional, on the other hand, we believe would normally be coming in at a less stressful time, with a more reasonable outline, and work within the parameters and within the groups of a water management team. So under ASHRAE 188, the intention there is to proactively assess the risks within a facility and its water systems, and to do a routine assessment of the facility, a risk assessment, to determine, is it a health risk, and how do we incrementally lower those risks. That is a forever project. It's not just a one-time thing, because the building is aging and its water systems change, construction, renovations happen, the outside water quality parameters change, water usage changes, the water treatment changes. So it's a constant thing. And so someone needs to keep up with that and make sure that they're ordering the necessary measurements and getting those values in, reviewing that data, making sense of it, interpreting it, making recommendations for corrective actions, and then eventually any modifications to the plan would then be prescribed and directed by a program professional. They're not exclusive to each other. There's a lot of overlap, but there's certainly things that someone at a health department would probably never do as a responder professional that really would be the day in and day out things that a program professional would do. So I think there's a lot of differentiation there. But what we're really trying to do is make sure that those people who are tasked with those higher level efforts to develop those sampling plans, make changes, interpret data, make recommendations, and basically oversee the health and safety of anybody who uses the water in that facility, have a deeper understanding of what's going on.
David, thank you so much for joining us today.
I appreciate the opportunity and look forward to seeing everyone at conference.
That wraps up today's episode of the AIHA's Healthier Workplaces show. To learn more, visit the AIHA website and follow us on social media. Thank you for tuning in, and as always, remember that healthier workplaces mean a healthier world. Until next time.